The other dangerous provision in the stimulus legislation involves a huge increase in funding for something called comparative effectiveness research. What is that? Well, it's very familiar to economists. It's really generally a code phrase for rationing based on age. The formula is very familiar to the economic world. You take the cost of the treatment and you divide it by the number of years the patient is likely to benefit. They're called quality-adjusted life years. This system is widely used in the UK to determine which treatments the British National Health Service will pay for and which patients will be eligible. And treatments for age-related diseases such as osteoporosis or macular degeneration are often denied because patients don't have many years left to benefit. When this substantial funding for comparative effectiveness research was slipped into the stimulus legislation, Charles Boustany Jr., Dr. Charles Boustany Jr., a heart surgeon from Louisiana and a member of Congress, warned that it would lead to depriving seniors life-saving care. But it has long been proposed as an effective method of limiting spending, particularly on seniors. For example, Peter Orszag, who's now running OMB for the Obama administration, testified to Congress in 2007 that comparative effectiveness research coupled or linked with financial incentives for doctors and hospitals would be a promising method of reducing healthcare spending. And in the November-December 2008 issue of Health Affairs, which is kind of the Inside the Beltway medical journal, it was proposed that limiting the hundreds of thousands of hip and knee transplants offered every year could be done effectively with comparative effectiveness research. Most older patients simply wouldn't qualify. Right? Well, now that this huge funding for comparative effectiveness research is the law of the land, Dr. Ezekiel Emanuel will probably have a large impact on how it's used because of his writings on euthanasia and age-based rationing against seniors. He is a key health policy person in the Office of Management and Budget, the agency that will be leading most healthcare legislation on behalf of the administration. He is also the brother of the President's Chief of Staff, Rahm Emanuel. And on March 17th, he was appointed to the new Federal Council on Comparative Effectiveness Research. So Dr. Emanuel is in a position to put his views into practice. Dr. Emanuel is part of a growing school of thought that blames the Hippocratic Oath, in part, for the rapid increase in health spending. Take a look at what he says. In an article in the Journal of the American Medical Association last June, Dr. Emanuel identifies the Hippocratic Oath as one of 7 factors driving overuse, that's his word, overuse of medical care. Medical education and postgraduate education emphasize thoroughness. This mentality carries over into practice, and peer recognition, he writes, goes to the most thorough and aggressive physicians. This culture is further enforced by a unique understanding of professional obligations, specifically the Hippocratic Oath's admonition, quote, to use my power to help the sick to the best of my ability and judgment as an imperative to do everything for the patient, regardless of the cost or effects on others. Of course, that's what most patients expect their doctor to do. They don't want their doctor looking at them in their bed and thinking, you know, maybe the cost should go to the lady down the hall, or how about to the arts or education funding instead? Right? But in fact, that's what Dr. Ezekiel Emanuel suggests in his writings. Take a look. Right? Now, we've been told again and again that Americans have to do with less and sacrifice health care limit what they spend for their families in order to get the economy booming. How true is that? The Washington bureaucrats are sounding like Europeans, talking about healthcare as a cost problem rather than as a family's top priority and as the #1 employer, #1 growth industry in the United States. Now the question is, why do Americans spend 17% of GDP on healthcare when other countries don't? It's because they can afford to. Now, I'm pointing out here the research of two people, Dr. David Blumenthal, now part of the administration, and Uwe Reithart from Princeton. And they both explained that the single largest factor accounting for 90% of the difference in spending per capita on healthcare between the US and other countries that are often cited, 90% of that difference is due to the higher GDP per capita in the United States. Richer people, richer countries choose to spend more on healthcare. They do it because they can afford to. Now, take a look at this. This is really interesting. This is a graph that points to two things. As you can see here, food and energy as a percentage of GDP has been steadily declining since 1960. Spending on healthcare as a percent, actually this is not a percentage of GDP, it's about 70% of GDP, it's consumer spending I chose to measure. It's a little more vivid. Medical spending as a percentage of total consumer spending has been rising. In other words, and this is very typical as nations become more developed, as they become more and more proficient at providing for other necessities with a small part of GDP, advanced nations spend less on housing, food, and energy. They have money left over to spend on another top family priority, medicine. Now, take a look at what's happened to spending on family essentials since 1960. I've combined medical, food, and energy as a percentage of total consumer spending. It's a flat line. What does that say? In a macroeconomic sense, for the nation as a whole, medicine, spending on medicine is not burdening families more than it did in 1960 because they have to spend less on food and other essentials. Now, let me just show you housing. This is imputed rent, also steady. So the fact is that when Americans have to reach into their pocketbooks to pay for all their essentials, it's been relatively the same as in 1960. That doesn't mean that it hasn't been a hardship for anyone. And the key for all of us is to provide assistance for those who can't afford health insurance. That's better than rationing care for everyone and submitting to top-down government controls. Let's reach out and help the sectors of the economy who are having trouble paying for this. Now, just to show you where we really are economically, in addition to spending on medicine as a percentage of total consumer spending, the other area that has been steadily rising since 1960 is recreation. A sure sign that overall, most families have not been so stressed out by medical care that they can't afford to go to the movies or take a vacation, right? In fact, their spending on those items has doubled as a percentage of total consumer spending since 1960.